That's Laura Tamblin-Watts, who went on to tell us a big part of the problem is that PSWs, personal support workers, the people who feed and care for the residents, do not earn a living wage at one facility, so they often have to work at several residences. New federal guidelines that have just come out recommend staffers work at only one facility, but long-term care homes are provincially regulated. Tamblin-Watts says the federal government needs to transfer more funding to the provinces to fix what she calls a structural problem. Another group of people who are vulnerable, especially to the spread of the virus, are people who are living in temporary housing, like homeless and women's shelters. Close living quarters and shared access to washroom facilities, that all puts them at high risk. This morning, we're also learning of an outbreak at a refugee settlement facility in Toronto, where 4 people have now tested positive. We're talking about the Willowdale Welcome Centre, and Natalie Nanowski is live in Toronto with the latest details on this. Natalie.
Heather, well, we have learned that it's at least 4 people now. So I just got off the phone with the head of Homes First. That is the agency that runs that refugee center, along with several other shelters in the city of Toronto. And she told me that 4 people, and it's a mixture of staff and refugee claimants, have come down with what staff believe is COVID-19. So they went through the checklist. If there is, heaviness in the chest, or if someone has a fever, they checked off those symptoms, and those refugee claimants have now been sent to facilities, isolation facilities within the city of Toronto, whereas the staff also has been sent home. Now, as you mentioned, this is some of the city's most vulnerable. These spaces are often very tight. They're very close together. So what the head of Homes First told me is that they're really paring down these facilities. They are making sure to space people out, space beds out, also space computers out. And instead of, let's say, housing 200 people at one facility, they're now housing 100 and sending the other people elsewhere. So she told me, thankfully, the city of Toronto has put up some shelters inside hotels. It's purchased hotel spaces, so these people are going there. But her shelter is not the only one. This refugee shelter is not the only one that has COVID-19 cases. There are others in the city. We know of at least 10 cases at this point. Heather?
So those are the residents, as you've highlighted there, Natalie, but what about concerns for staff who work at these facilities? What are we hearing from the province there?
So we do know, just even from the head of Homes First, that staff are a little bit worried. They are anxious, knowing that there are COVID-19 cases or presumptive COVID-19 cases at some of their facilities. So they are worried about that. However, many of them are wearing masks and gloves when they do interact in these close quarters with homeless people or refugee claimants. We are also told that there's plexiglass that has been put up as like a barrier between people as well. So that is one of the things. However, things like hand sanitizer can't be left out, because what I'm told is some of the staff is worried that that some of the people will drink it. We are being told, though, however, that there is a shortage of supplies, and they're hoping to get some more later this week. Heather?